Now we'll have the next speaker is Dr. Mahindra Kar and he'll be talking to us on results of sutureless vitrectomy for symptomatic floaters in pseudophakic eyes. Dr. Aniruddha, please.
Yeah. Good morning, everybody. So here we'll be discussing about sutureless vitrectomy for symptomatic floaters. So floaters are in fact one of the most common presenting symptoms in our OPD, and patients are really irritated with them. So persistent and symptomatic floaters for long time should ideally be treated. It's not moving. Yeah. Here we study the safety and efficacy of sutureless pars plana vitrectomy for symptomatic floaters in pseudophakic eyes. In this, long-term symptomatic patients were included who had symptoms for at least 2 years. Informed consent and alternative treatment options were discussed. They had symptomatic floaters which caused detrimental impairment of their daily functional activities, and the quality of life was severely impaired. So most patients were examined on multiple visits. Surgical intervention was avoided initially. Patient had a lot of quality of life issues, and then the risk of pars plana vitrectomy was discussed, and then only intervention was decided. The patients having significant retinal abnormalities including epiretinal membrane, retinal detachment, vitreous hemorrhage were excluded from the study. A core vitrectomy was performed. The vitreous was removed up to the vitreous base with proper shaving. PVD in those cases where there was none was induced, and extensive search for retinal breaks were conducted. Results were followed up to 18 months on an average. The demographic showed 63 years of mean age, 48% were males. Etiology, most of them were PVD, 60%, and asteroid hyalosis. So the outcome showed that the visual acuity improved from 618 to 69. 80% of the patients completed the questionnaire. Of that, 96.5% were satisfied, and almost 85% said that it was a major success. Pre-existing PVD was present in majority of the patients. In those whom it was not present, that is 17%, it was induced, but none of them had developed a retinal tear. However, an iatrogenic retinal tear was noticed in an eye in whom it was already documented as PVD. The post-op complications, none were severe complications, like no patient had retinal detachment or end-off, but minor complications, cystoid macular edema was present in one eye, and vitreous haze was present in 2 eyes. So sutureless pars plana vitrectomy, unlike the previous 20-gauge vitrectomy, is definitely better. It decreases the surgically induced trauma, the operative time, and post-op inflammation, and helps in rapid recovery. Therefore, there is a significant improvement in visual acuity and patient satisfaction, especially in those patients who had severe quality of life issues preoperatively. There is a low complication rate. Iatrogenic retinal tear rate is also comparable with other indications for vitrectomy, and no difference in PVD induction or no PVD induction is seen. The limitations of this study is that it is a retrospective study. There can be a selection bias. There is a limited patient population, difficulty, and the patients underwent survey few months after the study. So high patient satisfaction was found, active lifestyle and quality of life improved, and vitreoretinal specialist, as vitreoretinal specialist, we should increasingly be sensitive to patients' subjective impairment and visual complaints, and be increasingly willing to offer potential treatment options like sutureless vitrectomy to alleviate their symptoms. Thank you.
Good presentation. Have you compared your results with the YAG laser for vitreous floaters?
No, here we have not compared the results with other modalities of treatment like
Do you have
YAG.
any experience?
No, with YAG hyaloid for vitreous floaters.
Floaters, because that's been promoted, and there are many presentations now where they claim that it's as good. There are some people who are only practicing as vitreous floater treatment people, but I think the message here is that the vitrectomy is fairly safe, and if you take the proper precautions, as he said specifically that you have to watch for breaks. If you do that, I think it's a fairly good procedure, and your patients seem to be quite satisfied.
Yeah.
Thank you.
Thank you.